As you know, we all have circadian clock in the brain and peripheral organs, which generate a 24 circadian rhythms in physiology and behavior. And it has been widely established that the immune system is tightly controlled by the circadian clock system. In the case of antibody response to the COVID vaccine, two papers have already published in Cell Research and JBR. In these two papers, the authors examined the association between the time of day of vaccination for COVID vaccine and antibody response in healthcare workers. And the type of vaccine are different: inactivated vaccine, mRNA vaccine, and recombinant vaccine. And these papers suggest that antibody response to the time of day of vaccination is dependent on the type of vaccine, participants' age, and sex. In our study, we have tried to examine the time of day of vaccination and antibody response in non-healthcare workers. We recruited the participants from the university students and staff, and we measured the antibody titer after following the first dose of vaccination by the Moderna mRNA COVID vaccine. Since there were no study to evaluate the time of day of vaccination for this vaccine, we could collect a total of 332 Japanese adult starters. The participants received the first dose of Moderna COVID vaccine 2 to 4 weeks prior to the study, and we collected basic information of participants, including sex, age, allergy, medication, chronic disease, days after vaccination, average sleep duration, and time of day of vaccination. And we collected the blood sample and measured serum antibody titers. We analyzed the association between the antibody titer and several factors using a general linear regression analysis. And what we found is that the antibody titer is decreased in older participants aged in 50 and 60 years, and significant association was not observed between the time of day of vaccination and antibody titers. Our study provides the evidence that the vaccination time with Moderna mRNA COVID vaccine was not associated with antibody titer in non-healthcare workers, suggesting that these results do not support restricting vaccination to a particular time of day, and we hope that the present finding may be useful in optimizing vaccination strategies for the SARS-CoV-2 and other infectious diseases.